The topic for today, alopecia or hair loss. It could be caused by different factors. It could be hereditary, medical conditions, due to medications, hormonal changes, even normal part of aging. And depending on the cause, it's the different types of alopecia, starting with hereditary reasons or androgenic alopecia. Androgenic alopecia is an hereditary condition that appears with aging. This is the most common cause of hair loss. It consists of a male pattern hair loss and a female pattern hair loss. In the male case, it's a very defined, very predictable hair loss versus in the female, which is generally the thinning of the hair over the head. Alopecia areata is another type of hair loss. This one is caused by an autoimmune condition. In this case, the immune cells attack the hair follicles, preventing hair to grow. There are different types. Is the patchy type, on which there are patches of baldness in the scalp. Another one is the alopecia areata totalis, which the total of the scalp is gone. There's no hair. And then there is the alopecia areata universalis, in which the entire hair of the body is gone, including scalp, pubic, eyebrows, eyelashes, under the armpits. There's no hair in the body. In mild cases, with a limited amount of hair loss, the hair can regrow without treatment, although cases can reappear throughout patient's life. Traditionally, the treatment includes steroid injections in the area of which the hair is lost. Steroid suppresses the immune cells that are attacking the follicles, so hair can regrow. Another type of alopecia is called scarring alopecia. This is a group of conditions that destroy the hair follicles, replacing it with scarring tissue. In this condition, the hair loss is permanent. This group includes frontal fibrosis alopecia. In frontal fibrosis alopecia, the hair falls out across the front of the scalp. This condition can also affect the eyebrows. Central centrifugal cicatrizal alopecia, or CCC alopecia. In this condition, the scarring tissue affects the central part of the scalp instead of the frontal part. Again, this condition is permanent. Hormonal changes can also cause alopecia, like pregnancy, childbirth, menopause, or thyroid problems. Infections like ringworm can also cause alopecia. Also, certain medications can also cause hair loss. In this case, most common ones like medication used for cancer, immunosuppressors, medications used for gout, arthritis, depression, heart problems. Another common one, chemotherapy-induced alopecia, in which the hair falls out following a chemotherapy. It's one of the most visible, distressing side effects of commonly administered chemotherapy drugs. Fortunately, the hair grows back after the chemotherapy up to a certain degree. Stress can also cause a type of alopecia called telogen effluvium. In this case, during a stressful time, hair can fall out more easily, but it's restored once the stress is resolved. Another psychological condition that can cause the hair to fall is a condition called trichotillomania. Trichotillomania, or hair pulling. In this condition, this is a psychological condition on which you cannot stop pulling your hair, causing it to fall. The most common places would be the scalp and the eyebrows. Yikes. There is also a condition called traction alopecia. This happens when hair falls out because this has been pulled in the same way for a long time. This is often caused by tight hairstyles, relaxers, and extensions. There are a number of risk factors that could affect and cause your hair to fall. These conditions would include a family history of baldness, either your mother or father's side, age, significant weight loss in a short period of time, certain medical conditions like diabetes and lupus, stress, and poor nutrition as well. Talking about prevention, there are certain things that we could do to help our scalp over the years. This would include: don't overheat your hair. Don't comb your hair when wet. Be careful with bleaches and permanent color chemicals. Try not to stress too much. This one is easier said than done. We all know that. But as long as we can avoid getting stress for certain things, avoid stress as much as we can. I would say that. Take care when using extensions and braids. Don't lose weight too fast. This one is important. That could affect us in more ways than we can imagine. So let's take it easy when losing weight. There are certain foods that we can consume that help us preserve a healthy hair. Those foods include salmon for shine due to the omega-3 fatty acids. Also Greek yogurt. This is very good for growth and blood flow because it contains B5 or pantothenic acid, which also helps prevent loss. Spinach is one of the best foods you can consume to preserve and conserve a healthy hair because it contains a ton of nutrients and vitamins which will help us with our hair. Those include vitamin A, iron, beta-carotene, folate, and vitamin C. Also, talking about vitamin C, guava fruit contains an immense amount of vitamin C, which help keep our hair strong and prevents breaking off of the hair. For iron, you can check iron fortified cereals. You can also find iron in beans like lentils, also beef, especially liver, and in dark leafy vegetables. For thickness of the hair, you need lean poultry due to the protein, which is the building block for healthy cells, including the cells from your hair. Chicken and turkey is one of the best sources because they have less saturated fat. Cinnamon also helps with circulation, which brings oxygen and nutrients to the hair follicles. Eggs for proteins as well, and iron will help with the growth due to vitamin B found in them, called biotin. This helps hair to grow like nothing else. And no conversation about nutrition would be complete without zinc. This is indispensable for any good hair. And where do we find zinc? Oysters. Oysters is a great source of zinc. Also, you can find it in beef, crab, lobster, and fortified cereals. And last but not least by any means, thinning of the hair or hair loss could be a sign of malnutrition, that what we are eating is not getting through. It could be a gut problem. This could be a sign of problems in the gastrointestinal tract, occasionally a sign of insufficient stomach acids, and that we are not absorbing proteins, zinc, and other nutrients. That's why I always recommend probiotics, which will help us with the breakdown of the food, absorb the nutrients, and help us fight the bad bacteria. You can take this between meals, at least 2 tablets between meals. That would be 4 to 6 tablets per day for at least 2 months. Also, for us men, a low-fat diet helps slow down the baldness process. On some level, male pattern baldness might be tied to an increased testosterone level during puberty, which are often the result of a high-fat diet or eating too many animal products. You could also try a blend of bay and lavender essential oils to stimulate the scalp. It's recommended to add 6 drops of each oil to 4 ounces of warm carrier oil. This carrier oil could be almond oil, soybean, or sesame. Then you massage this mixture into the scalp and allow it to absorb for 20 minutes. Then you can wash it out with regular shampoo. Losing our hair is a psychological blow for most of us. That's why if there's something that we could do to preserve it as long as possible, we should. And as any part of our body, we should take care of it as much as we can. Thank you very much, community. Thank you for sticking around. If you have any other information about prevention or treatment, natural treatment, leave it in the comments. Remember, let's grow together. Any other topic that you would like me to discuss, any other topic that you'd like me to investigate, I'll be glad to do so. Leave it in the comments. Please share, subscribe if you haven't done so, give a like, and I'll see you on the next time.